welcome everybody to Freiburg. It's really a great pleasure that all of you have come to this basic liver immunology meeting here in Freiburg. As you know, Freiburg is home to one of the oldest universities which has been founded back in 1457. It's of course also known for its beautiful location within the Black Forest near France and Switzerland. So if you have time in between or afterwards, of course not in between, but afterwards, so you have a chance to travel, of course, also internationally. Now, Freiburg is not only famous to be the warmest city in Germany, and I think we're doing a good job today, but also for the focus on medical research and especially also on liver diseases. And this is a long tradition we have here in Freiburg, and it's depending on liver immunology, but also bile acids, etc. And some people say it might be a conflict of interest that we're focusing so much on liver diseases being surrounded by these wonderful vineyards we have everywhere here in the Black Forest. But for us, this is not a conflict of interest, but we call it translational medicine and translational research. And especially in Freiburg, we are very happy that all the speakers have come and accepted the invitation, because when we started to develop the program together with long-term colleagues here in Freiburg, with Maike Hofmann, with Bertram Bench and Tobias Böttler, it was our goal to bring together really top leading scientists and also a few emerging top leading scientists, and then make a perfect mix. So thank you very much that everybody is coming. I see that Arash and Percy are just thinking whether they are emerging or already. We will decide after your presentations, so we'll see. Now, a big thank you finally to the Falk Foundation, to Moritz Schreder and his team for a really wonderful organization to make it possible here today, even for organizing such a nice weather. I think we will have a great day, so I think this deserves much love. And of course, it's an honor to have this meeting here in Freiburg, the Falk meeting, because of course Falk is also founded in Freiburg. It was a pharmacist, Herbert Falk, the father of the current CEO, Martin Falk, who founded Falk and made it possible from the beginning to have this international symposium focused on liver diseases, on GI diseases. So there's kind of a family touch here in Freiburg, and it will also be seen tonight, for example, when Martin Falk will join us for the speakers' dinner, and also when we give the poster prizes tomorrow. So I think nothing else needs to be said. Thank you very much all for coming. I think you really have a great program, so I hope we have great discussions during the sessions, also afterwards. And now let's look forward to two-day race of science. And with this, I give over to the chairman of the first session. Thank you very much.
It's a great pleasure to invite Suchira Gallage from the M3 Research Center in Tübingen, very close to here, one of the rising stars in liver immunology. So we're looking forward to your presentation on how eating behaviors influence MASH.
Perfect. Thank you very much, Frank. And hello, everyone. It's a pleasure to be here. And thank you so much as well for this invitation to really present my work here. So today, as Frank mentioned, I will really talk about how we can potentially use a mitochondrial uncoupler as a therapeutic mimetic of intermittent fasting in the context of MASH and MASH-induced liver cancer. So I think everyone here is really aware of what MASH-LD is, but what I really want to emphasize here is that, this is really my disclosures, but yeah. So essentially what I really want to emphasize is that MASH-LD is predominantly a lifestyle-associated disease, and we all know that it has now really become the most prevalent chronic liver disease worldwide. And what is also really important to really mention is that it's really these Western diets, so diets rich in fatty foods and sugary drinks, this combination of fats and sugars that can drive a healthy liver into a state of steatosis, which might be rather benign in nature, but of course over time, this can progress into MASH or steatohepatitis, and of course, lead to cirrhosis and liver cancer. And also really seeing this from a metabolic perspective, what is also really important to emphasize is that MASH is also a systemic disease, so it's not really only a liver pathology. It involves multiple metabolic tissues, the gut microbiome, and the immune system. So given that it really is a disease of obesity, metabolic syndrome, and lifestyle, an obvious question that really comes up is, can we really use a dietary regimens to really improve MASH and MASH-induced liver cancer? So given that this is the case, especially over the past decade or so, this concept of intermittent fasting has really emerged, as a popular and effective intervention against a whole plethora of different metabolic diseases, against diabetes, obesity, etc. And one regimen that has really come to light is the so-called 5-2 fasting regimen, where 2 days per week, so say Monday and Thursday, you simply do not consume any foods, or you limit your calorie intake to about 500, but in the remaining 5 days, you can eat as you normally do. And we recently showed that this 5-2 fasting regimen is extremely beneficial in not only ameliorating MASH or steatohepatitis, in reducing liver fibrosis, but also in essentially blunting liver cancer development. So in essence, what we really asked was, can we really apply this 5-2 fasting regimen in a therapeutic approach to ameliorate MASH on one hand, but also blunt liver cancer development? So i.e., if it works, can we really translate these dietary regimens into the clinics to really treat MASH and MASH-induced liver cancer? So we first tackled this in a MASH context. So what we did is that we took our black 6 mice as a model, and we fed them with a Western diet, really for 5 months, to first induce a state of MASH or state of hepatitis, and only then did we start the 5-2 fasting regimen, and we continued for an additional 4 months, so 9 months of diet feeding. And what you can really nicely see here is, of course, these mice fed a Western diet. They clearly show hepatomegaly, lipid accumulation, fibrosis, and of course, essentially inflammation, both of the adaptive immunity, but also of the mono compartment, neutrophils, corpuscles, etc. But what is also very clear is that this fasting regimen essentially improved many of these features. These mice had less steatosis, inflammation, fibrosis, etc. So we really could essentially treat this MASH in a therapeutic manner. So we then took this one step further, and we also asked, can we really apply this 5-2 fasting regimen to also blunt liver cancer development? So just like before, we started this 5-2 fasting regimen after 5 months of Western diet feeding, and in this case, this was really long-term, so we continued until 15 months of diet feeding to really study MASH-induced liver cancer in these spontaneous models of MASH-HCC. And what you can really see here is that both the tumor size and the tumor numbers were significantly lower in this, essentially in this fasted mice, clearly showing that it can not only improve MASH, but also blunt liver cancer development over long term. So given that this is the case, we have now essentially started a MASH-LD clinical trial for 12 weeks in collaboration with Jörn Schattenberg at the University Hospital Saarland. And right now, these patients, essentially patient recruitment has begun. And we are also collecting these samples to look at the microbiome, serum samples, etc. So we really can follow this prospectively. But as one would imagine, right, if you're doing this fast, everyone knows fasting is beneficial, exercise is beneficial, right? But can anyone do this for very long term, whether it's 12 months, 6 months, etc.? So what we and also others who have used these regimens really have seen is that there are always, essentially compliance issues with long-term adherence of these regimens, So this concept of therapeutic mimetics, also, can we really mimic the effects of fasting or exercise using other pharmacological agents or essentially natural compounds have really come to light. So, and this is what I really want to talk about in my today's talk. But before really moving into the therapeutic mimetics of fasting or exercise, I think it's also important to first understand what is the current therapeutic landscape of MASH and MASH-induced liver cancer. So, and this really has changed over the past, 2 to 3 years. So we now finally have the first FDA and EMA approved drugs for MASH. On one hand, this is resmetirom, which is a liver-targeted THR-beta agonist, which is also shown to be quite effective. But of course, on the other hand, there are these GLP-1 receptor agonists like semaglutide, which have shown to be extremely beneficial, especially in lowering steatosis and to some degree also fibrosis. But unfortunately, these agents are not perfect. They also come with several limitations. So on one hand, we know, for example, there are a few studies showing that they're associated with gastrointestinal side effects like nausea, diarrhea, etc. But on the other hand, what's also a bit more disconcerting is that these drugs are also associated with muscle wasting, which is a huge risk factor for health span and aging. And in line with this, there are more and more recent studies showing that essentially if you come off these agents, you're up to 4 times more likely to regain your weight compared to if you have lost this weight using lifestyle interventions such as fasting or exercise. And this is mainly because you have lost, your muscle mass, which is the metabolic machinery of the body to really increase your basal metabolic rate. So given that this is the case, we essentially asked, are there potentially other targets of fasting that we could exploit for the treatment of MASH or steatohepatitis? And this is where we essentially noticed that mitochondrial biogenesis and oxidative phosphorylation seems to be potently induced by fasting, both in an acute setting, but also in a long-term MASH setting as well. So we really tackled this using two different approaches. So first of all, we essentially fed our mice with a Western diet, with or without these 5-2 fasting regimens. And in this case, we sacrificed the mice under different nutritional states. So in a fed, fasted, refed state. And what we essentially noticed was that transcriptional regulators like PGC1 alpha, which is the master regulator for mitochondrial biogenesis, was potently induced upon fasting, and then it essentially went back down upon refeeding. But this essentially coincided with multiple genes involved in fatty acid oxidation to be potently induced in an acute fasting setting. So it really seems that the mitochondria is boosted upon, when given these fasting regimens. But the key question is, does this hold true also in a long-term MASH setting as well? And indeed, this seems to be the case. So what we did here is that we fed these mice with a Western diet for 8 months and sacrificed the mice in a fed state, so in the same nutritional state. And we performed transcriptomics and GAC analysis, etc. But what we also noticed was that multiple pathways involved in the mitochondria, like translation, electron transport chain, oxidative phosphorylation, seems to be potently induced by fasting in these long-term chronic models of MASH or even MASH-induced liver cancer as well. So it really seems that fasting is really acting on the mitochondria and boosting its capabilities in the context of MASH. But an obvious question is, why is it even important to boost mitochondrial capacity in the context of MASH? And this is mainly because mitochondrial dysfunction and accumulation of ROS or reactive oxygen species are two of the major hallmarks of MASH or steatohepatitis. So of course, steatohepatitis is associated with not only an accumulation of free fatty acids, but also cytokines. It's this combination of both. And this is known to essentially impair beta oxidation, which in turn can essentially alter biogenesis, electron transport chain malfunction, decrease mitophagy, etc. And this over the long term can essentially induce ROS, which can essentially then act in a vicious cycle by propagating inflammation, mitochondrial DNA damage, etc. So what I've just shown you in the previous slide is that fasting can revert this process and boost essentially mitochondrial capacity, right? But the key issue is that no one wants to fast, no one wants to exercise. So can we use these so-called therapeutic mimetics to do this without fasting or without dieting? So the next question that really came up is, okay, can we use chemical agents? And if so, which ones to really tackle this question? And this is where this concept of mitochondrial uncoupling really has come about in the past decade or so as a treatment, maybe not only for MASH, but maybe for obesity, metabolic diseases, etc. And to really understand mitochondrial uncoupling, we really need to look at the electron transport chain. So I'm sorry, this is a bit of hardcore biochemistry, but maybe I think what everyone knows, hopefully, that, so essentially, when you go through the electron transport chain, right, these protons are pumped into the intermembrane space. And what normally happens is that, so essentially, when this happens, you create a proton gradient, and what lies at the end of this electron transport chain is ATP synthase, which can exploit this proton gradient to generate ATP. And what a mitochondrial uncoupler does is that it essentially dissociates ATP synthase from the electron transport chain, because these uncouplers can directly bind to the protons and essentially shuttle them across the mitochondrial matrix. And what this does is that the energy that is produced through glycolysis, oxidative phosphorylation, is dissipated as heat and not produced as ATP. And this, at least conceptually, this would be really useful in an environment such as essentially steatosis, because you're using up all the fatty acids and not producing essentially ATP. So thereby you can really burn through the steatosis, improve inflammation, etc. But then the question is, there are multiple mitochondrial uncouplers. Can we use this? And is it even safe to use this in a systemic manner? Or does it have to be more in a liver-targeted manner to avoid toxicity and to reduce side effects? And the compound that we really focused on was DNP, or dinitrophenol, which is actually one of the oldest protonophoric mitochondrial uncouplers. And at least for me, the history of this compound is extremely interesting. So it was originally used in the First World War for explosive manufacturing. And what they noticed was that these munition workers exposed to DNP, they experienced rapid weight loss. So in the 1930s, it was introduced in the States as a weight loss drug. And it was actually extremely effective. Many patients lost their weight, but unfortunately, it had to be withdrawn by the FDA because it was extremely toxic at the same time. These patients had hypothermia, so essentially this was not cachectic, etc. So unfortunately, it was quite toxic. But in the past decade, there was a new formulation of DNP termed CRMP, or controlled release mitochondrial protonophore, which is a liver-targeted form of DNP. And the major difference of the CRMP compared to DNP is that it had lower peak plasma concentrations, so which meant that there was sustained release pharmacokinetics. And it has now been shown to be extremely safe in both non-human primates and also in humans. And this work really has been spearheaded by Gerard Schulman, at Yale, where he has shown, the past decade that the CRMP is extremely effective in not only reversing diabetes, but also dyslipidemia and also early stages of steatosis, even in essentially non-human primates. But whether CRMP is effective, in severe MASH, steatohepatitis, late-stage fibrosis, and in MASH-induced liver cancer was not really studied. And this is where we essentially started this collaboration with Jerry and also together with Matthias Hakenwalder at the DKFZ. And right now, this project is really driven by Winnie, who is also here in the audience. So we did a whole series of different experiments using Western diet, CD-fat diets, etc. But for the sake of time, I will focus on one of these long-term experiments. So just like before, in the context of fasting, what we did here is that we fed the mice with a CD-high-fat diet for 7 months to first induce a state of MASH, and only then started with the CRMP treatment and continued until 15 months of diet treatment. And as I mentioned, this really is a liver-targeted formulation of CRMP or DNP. So it had absolutely no effect in the body weight. So these mice remained obese. So they were about 60 grams in size. But when you then go and look into the liver profile, it was quite clear that the liver weights were significantly lower in the mice treated with the CRMP, plus also essentially serum ALT, a mark of liver damage. And when we looked at the histopathology, we could really confirm or corroborate these findings. So we could really show that this mice treated with CRMP had less steatosis, less fibrosis, and less immune infiltration, both for the myeloid compartment, so CD8, PD1 T cells, etc. So we really could show even in these very long-term models that the CRMP can revert, many features of MASH or steatohepatitis. But the question was, can we also blunt, diet-induced MASH to HCC transition using the CRMP agent as well? And indeed, this was the case, at least to a large extent. So these mice had, significantly or quite strikingly lower tumor incidence, significantly lower tumor numbers, and significantly lower tumor sizes. So altogether, we could really confirm that this agent not only ameliorates late-stage MASH and fibrosis, but it can also blunt diet-induced liver cancer in these models. But the key question was, how does CRMP really do this? So is it only by lowering stress pathways, for example, ROS, or is there something more to this? So we first looked at multiple stress pathways from, DNA damage, lipid peroxidation, ER stress, and what was quite evident was that all of these markers were significantly less in the mice treated with CRMP, and this was evident in a CD-high-fat diet, Western diet, etc. And we focused a bit more into the ER stress because this was quite striking with the reduction in BIP, CHOP levels, but I will not go into all the details today for the sake of time. But what we noticed was that CRMP was mainly reducing this PERK ATF4 pathway of the ER stress, of the 3 distinct ER stress pathways. Then we essentially asked, are there other molecular targets of CRMP, or does it only mediate its benefits by modulating essentially these ROS pathways, ER stress, etc.? So to tackle this question, we performed, essentially took the livers and performed transcriptomics, and what was quite evident was that there were hundreds of genes essentially that were differentially expressed between these, essentially the vehicle-treated mice and the CRMP. We then essentially delved into this in a bit more detail by performing gene ontology and essentially pathway analysis. And what was also, as one would imagine, it was quite obvious that many pathways involved in mitochondrial oxidation, electron transport chain, ATP synthesis was essentially enriched in the context of the CRMP-treated mice. But this essentially coincided with a reduction in fibrosis pathways, inflammation, plus also mutagenic pathways like MAP kinases, ERK signaling, Rho GTPases, etc. But what was actually really striking for us was that when we performed pathway analysis to look at upstream regulators, we noticed that the glucocorticoid receptor essentially seems to be at the center of the CRMP treatment response. And on one hand, this makes sense since glucocorticoids are a natural immunosuppressant, so you can dampen inflammation, you can dampen fibrosis, but also at the same time promote essentially metabolic machinery like gluconeogenesis, fatty acid oxidation. And in the past, we have also shown that fasting mediates its benefits in the context of MASH by promoting GR signaling and by inducing, for example, PCK1 expression. But in the context of fasting, it does this at a systemic level, not necessarily at the liver stage. So how fasting elevates glucocorticoids is through the hypothalamic pituitary adrenal axis, which in turn, these glucocorticoids then bind to the receptor in the liver to mediate the transcriptional cascade. So we first began by asking, does CRMP act at a global systemic level, or is it more liver targeted? So we looked at essentially serum corticosterone, and this was essentially not significantly different between the two different groups. So it was quite clear that most likely CRMP is acting on the liver, most likely at the transcription level or something upstream. So we were thinking about, okay, how can you essentially activate the GR receptor, right? So most likely CRMP must be acting through an intermediary, and we hypothesized it could be through something like PGC1 alpha, which is not only a master regulator of mitochondrial biogenesis, but it's also a very important GR co-activator. And usually, PGC1 alpha is induced by high levels of AMP kinase or SIRT1, which in turn is activated by low ATP levels or high NAD plus levels. So the question was, does CRMP act at these levels of these metabolites by essentially inducing either low ATP levels or by promoting NAD? So to really tackle this question, we took our livers and we performed NMR metabolomics. And indeed, this was what was happening. So we could really confirm, as one would expect, that with CRMP, by uncoupling the mitochondria, these mice essentially had much lower levels of ATP, but at the same time, they had very high levels of NAD+, which is very important to boost the mitochondria and to promote these reactions from happening. And we could also confirm at the transcriptional and at the protein level, multiple genes involved in the GR, like PCK1, FKBP5, to be really potently induced by essentially CRMP. And at the moment, we are also doing causal experiments in vivo to really delete GR and to prove that CRMP is really acting through this axis in a mechanistic causal manner as well. But we really want to confirm whether CRMP can really activate GR in a direct manner, or are we observing these things simply because of in vivo indirect effects, etc. So to tackle this question, we took advantage of an in vitro MASH model, which is this differentiated Hepag cells, and we treated these cells with both fatty acids and cytokines to really mimic a steatohepatitis microenvironment. And as I mentioned, we essentially gave DNP, which is the active compound that is found in CRMP. And we first looked at body P or lipid accumulation in this setting. So of course, as one would expect, if you give these cells with fatty acids and cytokines, you see a nice accumulation of lipids. And this is prevented if you essentially treat the cells at the same time with DNP. But we really want to confirm, how does CRMP or DNP essentially induce GR signaling? So we gave DNP with or without hydrocortisone. And there are actually two interesting essentially phenotypes when it came to this. So on one hand, DNP by itself did not induce any essentially GR target genes by itself. So DNP is not a direct agonist of glucocorticoids. But when you treat these cells with hydrocortisone, we saw a nice induction of these GR target genes, which is essentially prevented if you're essentially in a MASH environment or with fatty acids and cytokines. And if you give DNP at the same time with hydrocortisone, you completely revert this. So most likely what CRMP does is that it's reverting the metabolic dysfunction that happens in the state of MASH or steatohepatitis. So what I have shown you today is essentially that this agent, this mitochondrial uncoupler, is improving MASH and MASH-induced liver cancer through a dual axis. So on one hand, it seems to be lowering ROS, which in turn is essentially acting to reduce its ATF4 ER stress pathways, but at the same time, CRMP through this mitochondrial biogenesis essentially regulated PGC1 alpha induces GR signaling, which in turn essentially dampens inflammation and cell activation. But at the same time, one would ask, okay, does CRMP also directly influence the tumor as well? And the short answer, yes, it does. Which I unfortunately don't have the time to go into today. And right now, we are also trying to investigate this in a bit more detail with also, Jesus Gill in London, but also Robert, who is also here. We're trying to understand whether these mitochondrial uncouplers have a certain vulnerability in the context of, MYC addiction, AKT, RAS, mTOR, etc. And as I mentioned, we're also working together with also Bio, who really are trying to take these mitochondrial uncouplers to the clinics, especially in the case of obesity, type 2 diabetes, and they've already passed phase 1 clinical trials, and they have now really entered phase 2 trials for diabetes. And hopefully, if the data is quite positive for MASH, they may also think of taking this further in the context of MASH as well. So with this, I just really want to thank everyone who was involved, especially everyone in my team, and in particular Vinny, who really has driven this project. And also, as I mentioned, this really is a joint project together with Matthias Falkenwalder, who's at the DKFZ, and also at the M3, plus also all of our collaborators from Jerry to Robert, Jesus, etc., and also especially my main funders, who are essentially Dr. Krebs Hill for the Max ADA project. And thank you very much for your attention.